My name is Gilbert Hudson. I'm 62 years old. I live in Lathrop, California. One day I was eating and I couldn't swallow. The food felt like it'd get stuck here and pretty soon it would go down. After about a month of it, we decided we better go have it checked. They did a CT scan, that's where they found where I had esophageal cancer.
We were kind of dumbfounded. We went down to San Francisco to go to another hospital.
They had me do chemo and radiation. And then in September, they did the surgery, which went bad. I did 2 more surgeries, and after that, I was left with a bag on my neck and a feeding tube. I was ready to just call it quits. It was getting too much.
I'm about ready to lose my husband. He gave up.
So they referred me down to Stanford.
Mr. Hudson, unfortunately, is like several of the patients that I have come to the office. He was severely depressed. His quality of life was severely compromised. He was 100% relying on eating from a can through a tube directly into his intestines. Esophageal reconstruction is an operation which basically restores that tube that goes from your mouth to your stomach. Luckily, there are a variety of different kinds of conduits or tubes that we can borrow from the body. Here at Stanford, we utilize the small intestine, which is a much better size match, and we utilize the technique of microsurgery to augment the blood supply. It's a very difficult operation to do, and we do it as a team in collaboration with the surgical oncologists and the thoracic surgeons. We have a certain rhythm that we work together, we communicate together, and I think that we would all agree that patients get much better care when you have different specialists working together as a team taking care of that patient.
They did the surgery. They took the small intestine and they rehooked it back up to my esophagus, and they put part of my intestine outside of my chest.
We create what's called a monitoring segment. If that piece of monitoring intestine is doing well, there's good blood flow, then presumably the internal conduit is also okay.
They'd flick it and it'd pulse. That way they knew it was still, had blood going to it and it was still alive.
He called it George. It was like he had his own pet.
After a week in the hospital, once we know that the blood vessel's secured and doing well, we actually will remove that small little piece of tissue at the bedside. The outcome was beyond great. I think it truly changed his life.
Oh my goodness. Nobody knows what it feels like not to eat for months and months and then actually get food in your mouth. It was just a whole new experience. That was good. Stanford is an awesome hospital. The type of caring that you get down there is just bar none.
He's my love of my life. And we got camping trips we want to do. We got trout fishing we want to do. I told him all along, I said, you can't leave me because I got to show you how to fish.
I have my ups and downs. I got more ups than I have downs now. It gets better every month that I'm home, it gets better. It always gets better.